Now we look at the summary, and this is more of like we are trying to look at drugs that fall under the treatment of this medical condition of the heart, which is the coronary syndrome. So for coronary syndrome, you can have the acute one, you can have the chronic one. The acute one is more of like it's starting within a short period of time, while the chronic one is coming after a long time. So pharmacotherapy of the acute and the chronic coronary syndrome. So this is what we have. The acute coronary syndrome, the goals, that's the treatment. You stabilize the patient. If there's any blockage in the blood vessel, you relieve the person, that's the ischemia. Prevent any blood clots. Reduce what? Damage to the heart muscles. Then drugs that you use include aspirin, which is an antiplatelet to prevent platelets from coming together, thereby clotting. Then other drugs like the clopidogrel, the prasugrel, the ticagrelor. Then we have other ones like the nitroglycerin, we have the morphine, we have the fentanyl. Okay, then also oxygen. Okay, give oxygen therapy, especially if the person is lacking oxygen, the breathing is not, going nice. They also give anticoagulants, okay, like unfractionated heparin, low molecular weight heparin, then also the fondaparinux. Then we have beta blockers. Those ones, they reduce myocardial oxygen demand. That's like how your muscles will be requesting for oxygen to reduce it. Then we also have statins. So additional agents include angiotensin converting enzyme inhibitors, angiotensin receptor blockers, then also the aldosterone antagonist. This aspirin. Okay. That's for the acute, okay? So for the chronic one, has to be with long-term prevention of ischemia, symptom control and risk factor management. Then antiplatelet therapy, where you give aspirin, clopidogrel. We also have the anti-angina therapy, where you have the beta blockers, you have the calcium channel blockers, we have long-acting nitrates, we have the ranolazine. Okay, those ones are basically angina therapies. That's pain of the heart. Clopidogrel. So secondary prevention includes use statins, also the angiotensin converting enzyme inhibitors, also the angiotensin receptor blockers, then lifestyle control, risk factor controls, the person should stop smoking, the kind of food they are eating, exercise, control your blood pressure, control the diabetes. So this is ranolazine. Okay, so this is what we have for the different types of drugs that are used in treating these heart issues.